What has the last year been like for the fire department?
Yeah, I think the one thing I've said many times, both internally to our staff as well as externally when I've been asked, is we've really seen an explosive growth in call volume over the last 3 years, but the curve is steepening, which is the concerning thing. There's no sign of it kind of steadying out or plateauing or anything. And I'll tell you what that means for us. 2018, 2020. We were right around 60,000 calls a year, and it didn't vary very much. And we've always seen a steady, slow increase in call volume. It just happens, right? What we started to see, though, in 2021, we saw a jump to around 70,000 calls. 2022 jumped to around 80,000 calls. And this year, if we stay on track for what we see January through October, we're going to probably get 94,000 calls. So take that back to what I said at first, 60,000 calls in 2020 to 94,000 calls 3 years later. That's over 50% growth in volume, and it's not slowing down. So I don't think it's an exaggeration to say that's very significant growth for us, and it will challenge us. It also tells us that obviously something's going on in our community that is warranting that extra response for us. So we've taken a look, and we can see where the volume growth is. We're about 9% higher in fires this year over last year. We're about 22% higher in medical calls this year over last year, about 20% higher in false alarms this year over last year, and about 9% higher in motor vehicle collisions. Although that's still a bit of a recovery from the pandemic, when they really dropped during the pandemic. There was no traffic there, which meant cars rarely hit something else or hit each other. But what's actually driving that? We know the population is growing pretty quickly right now. We know that means more homes are being built. But fundamentally, I think, unfortunately, we also see the impact of unhoused people who are also experiencing addictions and mental health. And we know that's a big deal in terms of our volume, because that 22% increase in medical calls, critical medical interventions, within that 59%, there's a 59% increase in calls related to opioids and poisonings and things like that, which is clearly, again, suggesting that there's a problem with addictions in the city of Calgary.
What has that number meant for the individual firefighters at all the stations there? I would imagine it means a lot more work on their plate.
Yeah, the two things. It means a lot more work. They're getting a lot more calls. I think the other piece it means is there's an emotional toll with those kinds of calls. I talk to my crews, and many of them get to know unhoused people having those kind of difficulties by first name, and they may see them multiple times, and then they may end up going to the call where it's the last call we have to that person. And when you formed any kind of relationship with a person like that, it's difficult. It's tough. We're human beings. We can train people to do all kinds of things, but ultimately we all care. We all struggle with, especially when these folks are so vulnerable. Many of them are very young, and obviously they're struggling to survive in our world today. So yeah, our folks are busier. Our folks are also challenged by these kind of calls in different ways, emotionally.
I want to touch on some of the high-profile fires that we've had over the last year. I mean, obviously, the one that happened last week was quite shocking to many Calgarians, and like you said, I think it has probably affected the firefighters up in that area quite badly.
Absolutely.
But we've had multiple encampment fires along Deerfoot Trail, but we've had multiple house fires as well, and some high-rise fires as well. It seems like there has been a number of increasing issues that way in terms of people's safety. Can you walk me through what's going on there?
Yeah, well, that's what's difficult to explain sometimes, right? I mean, I said earlier, we've got about a 9% increase in fires, and those varies. We still see the greatest cause of fires in homes certainly as being cooking fires. And as you said, we've had a number of fires in high-rise buildings, and a growing trend, although still pretty small in the overall call volume of encampment fires. And I guess going to the encampment fires, which attract a lot of attention, as they should, and of course we saw the one in the garden shed outside the hardware store, Crowfoot, just last week, where three people, unhoused people, unfortunately passed away. That's something where it's so terrible, where a person's choice to just to stay warm or to cook is they'll start a propane stove within what is their home, but it's not always a safe situation, of course. I mean, many of the encampments we know have tarps, and those can be particularly flammable, and it's just a really unfortunate situation. And we work with our partners in the community, like the community peace officers, to where we can go and give education to those folks. But it's so difficult to create something that's totally safe when they're struggling to that degree. Yeah, we're seeing a number of things. We still, of course, encourage people to have working smoke alarms, working carbon monoxide alarms. We've had some events recently around carbon monoxide, which have been unfortunate as well, maybe not as high profile. Having those things in your home, in your workplace, where they should be, of course, mostly will be mandated by code, is very important. And we see a huge difference in outcomes where people are protected by smoke alarms and carbon monoxide alarms as opposed to those who aren't. And of course, that includes that group of the unhoused folks, unfortunately, who are living in encampments.
I want to touch on some of that stuff. Over the last, I would say, maybe 8 months or so, there's been some pretty high-profile events that the fire department's put on. Obviously, the junior fire chief's always a major highlight for a lot of folks there, but introducing VR training this year, introducing a variety of other sort of innovative programs there. Is that a change this year? Is that a change in the way that you're engaging with Calgarians?
I think we've always been pretty progressive, to be honest. I mean, those are great examples, you say. Of course, just yesterday as well, we were also, our Firefighters Toy Association put on the party they put on every year for folks who are less fortunate than us. Thousands of kids and their parents and guardians with them yesterday. I was there. It's just magical. I think we've always had an impact in the community beyond what people see all the time. You're right. The VR has been a leap forward. I mean, you're going to see us with an electric fire truck next year. We pride ourselves in embracing new technology and trying it as soon as we can, or getting ahead of the game. People look to Calgary Fire Department, I believe, in the fire industry as a progressive agency, and often want to see what we're doing. So I think good on us for doing that, and it's incumbent on us to do that. We have to constantly evaluate new technology to help us in firefighting, but often more importantly, where we can, much more importantly, where we can leverage that to prevent fires occurring in the first place, because that's obviously the best scenario. There's former fire chief Wayne Morris always used to say, there's no honor in fighting a fire that could have been prevented. And I think those words still ring true. And the other thing is we're going for our 6th accreditation with an international accreditation body next year. We were the first Canadian department to be accredited, and 6 is the maximum that any agency around the world times is the most that any agency has been accredited. So we open our doors every few years to have a peer team from other fire departments, fire chiefs, and others come in and really dig into what we do, and I can tell you they dig in very deeply, and we're confident again we'll be accredited, and we're an agency that kind of leads the field.
I want to touch on that future piece there.
Yeah.
Obviously, there's so many exciting things happening with the fire department there, and yet at the same time, you have those challenges. You have that increasing call volume.
Yeah.
I guess the question I would have is, how do you balance those two things going forward, having a bright future for the department, and at the same time having these systematic challenges that would seem to put ever-increasing pressures on the members having to fill those things?
I think part of it is just having amazing people. I mean, we have amazing people on the front line who provide that service to Calgarians. We have a smaller cadre of people who really do the research, and they look around to see what's happening new in the industry. We're very good with our kind of work planning, our business planning, to make sure that we are always on the lookout for different ways to do things. We have lots of connections from myself and into other people in the agency with chiefs across North America, sometimes around the world, to see what's changing in firefighting. So we really do keep our eyes open, and we do embrace change, and we also really look for what's emerging. I mean, we've got so much happening right now around lithium-ion batteries, and electric vehicles are going to be huge for us. Solar panels on homes. All of these things present different challenges than we faced years ago. We're clearly seeing today places where codes and regulations aren't even keeping up with technology. When you look at things like warehouses with robotic systems in there, I think most people would have never seen what some warehouses look like today, where much of the warehouse is operated by robots. And for the most part, it doesn't really present huge challenges for firefighting, but for some of those systems, there's some challenges there in terms of the way those are designed, the ways those are constructed. And unfortunately, they are ahead of the code development, which kind of puts some regulation in place in terms of how they develop. We're seeing, fires in parkades that we've never, or parking garages that we've never seen previously, based on the materials that are used in vehicles today. There's usually no firefighting systems in legacy parkades, no sprinklers or anything. You've got plastic fuel tanks. You've got obviously a high fuel load. You've got electric vehicles there now as well, although they're not. They much less catch fire, but when they do, it's more serious because the batteries are very difficult to get to and to extinguish the fire. And also, it's very tough to get a fire truck into a parkade. So it really presents huge challenges, and there have been a number of documented cases of huge losses in parking garages around the world. So there's all kinds of things we have to keep watching as technology changes, as the way people live. There's the conversation now around VRBOs, the Airbnb kind of setups as well, where there's no regulation of those, and they're being used very similarly to other kind of occupancies where there is regulation. So again, as our world changes, we have to keep pace with it.
I'm wondering if that technology side also extends into the residential sphere as well.
Yeah, of course.
I mean, obviously, laptop batteries,
Yeah.
people's phones, so many things we use now are lithium-ion powered. And I'm curious what kind of challenge that presents to the fire department, who may be having to fight a fire that was caused by that, but also the reality of, you might have one fire that starts in another home, spreads to another home, and then lights those devices on fire.
Yeah, certainly. I mean, there's lots of talk in the industry about that as well. When I talked about lithium-ion batteries, I talked about EVs, but then there's the mobility devices like the scooters and the bikes, and people who live in apartment buildings. Much though you'd like to see those charged outside, there's nowhere to charge them outside without them being at the risk of theft or whatever, and there often aren't power outlets outside. So what do people do? They charge them in the hallway or actually in their apartments. And there's videos on YouTube of how, not often, but these batteries, particularly if they're used with the wrong charger or they're charged incorrectly or they're damaged in some way, will explode into flames. And there have been deaths in New York City and other cities around North America. Vancouver is starting to see this frequently as well. And so that's the challenge. But you're right, down to your camera batteries, down to your laptop batteries, your cell phone batteries. There are many of them becoming lithium-ion again. And as long as they're used properly, they actually don't present a huge hazard. So I'm not saying they're bad, and they're going to be prevalent in our world because they're very capable of holding a charge, and they work very well. It's when they're charged incorrectly. People often will buy a charger off of Amazon or something that comes from a different part of the world where it's not been tested, and it's not necessarily the right output for the device. Lithium-ion batteries are subject to, if you drop them or crush them, they can be they can catch fire. There are many cases now of landfill fires where the big machinery that kind of crushes down the stuff in a landfill actually starts fires if there's lithium-ion batteries in there, because they rupture the battery, they cause trauma to the battery, and then it becomes unstable. So yeah, it's a residential. You talked about that spreading from home to home. Our homes today classically are closer together. There is some fire protection on some of them if they're within, I think it's the 2.5 meters or whatever, 8 feet. But it is a challenge. We've got a lot of legacy building stock in the city that was built very close together prior to that protection being in place. So it doesn't take very long for fire to spread from one home to another, for sure.
I want to step over to the medical side of things. Obviously, at the very end of 2022, it was very high profile that the fire department was taking on a much more active role in even transporting patients to hospital. There was significant issues in AHS, in EMS there. I mean, some of those issues have obviously been solved in the last 6 months. But I'm curious, what are the pressures that our firefighters are still facing on the medical side?
Yeah, I mean, things have improved. I think you touched on that. I think AHS, EMS have made some changes to be in the hospital for a shorter period of time. So I don't know, it's probably 8 months, 9 months ago, my firefighters were saying to me, Chief, there's been a huge improvement and they were telling me, it's like, whoa. And they're seeing EMS much quicker at calls, and they saw that. That's actually gone backwards a little bit since then as we track it, but it's still a significant improvement. We haven't transported a patient for a long time now because we're seeing this quicker response from EMS. And of course, I never want to be critical of the folks they have on the street are amazing people, and I bump into them often when I'm in fire stations. They're obviously doing everything they can, and they're very frustrated when they're held in the hospital for 2 or 3 hours or more taking care of patients in the hallway. So we've seen those things. Of course, it's a political issue as well. Council are very concerned that we've added a medical response unit back into service this year, and that has no purpose other than medical calls. So we're actually incurring extra costs that taxpayers pay for to supplement AHS's service. And of course, the belief of council, quite understandably, is we should be recovering those costs. That's not something that Alberta Health Services agrees with right now. So that becomes a bit of a political tension as well. But it is, our new medical response unit we put into service, I think, in January with some funding. Thank you, Council. It was wonderful to see that back in service. It's already up at about 5,800 calls this year. It's by far the busiest vehicle in the city, and it's having a huge impact. And if it hadn't been in service this year, I think we would have seen a bit more of a degradation in our performance for servicing Calgarians.
Walk me through that, the 1,500 number there. Obviously, talking about overdoses and other things, I think people are very familiar with firefighters on scene, especially downtown for those events. But what does that unit do outside of maybe that kind of medical call?
Well, it doesn't have time to do much else, let me tell you, at 5,800 calls a year if you do the math. But it will run medical calls in their simplest form, run a continuum of alpha through echo. Alpha being the least serious medical call, echo generally being someone who's in cardiac arrest and not breathing or with very, very serious injuries. And the fire department responds to delta and echo calls. So, and those calls are like a pyramid where the echo at the top is the least frequent call, the delta a bit more, and you get down to the alphas and then the bulk of the calls. So we actually don't respond to the bulk of medical calls in the city of Calgary, but the delta and echo calls are our focus. And within that, the medical response unit primarily will respond to delta calls, because for an echo call, you actually need more than 2 people on scene, and the unit only carries 2 people. It's an SUV, it can move very quickly through traffic. So it's primarily doing those calls where people are having breathing difficulty, or they're having chest pains, or they've suffered an overdose. They may need support in a number of ways, but it is the bulk of the medical calls that we actually attend that vehicle can go to. And it also may get sent to an echo call, but we'll always send another truck as well, because once you have someone who's in cardiac arrest and not breathing, there's so many tasks that have to be done that 2 people can't do. I mean, you need someone giving oxygen, someone doing CPR, someone managing the defibrillator, someone getting some medical information from the bystanders or family or whatever. That's 4 things I've named already, and you only have 2 people. It's tough. So, but that's where it's making, and 5,800 calls. It's a huge amount of calls. If you think of out of a call volume of 94,000, that's a very big proportion of those calls for sure.
I want to touch very briefly on maybe some of the environmental aspects that are happening. Obviously, we're heading into a pretty serious drought season in New Year here. How does, obviously wildfire is top of mind, but that's outside of the city in many cases. How is that going to impact what the fire department has to do in 2024?
Yeah, I mean, we're likely going to see a very dry spring, or even through the winter. I mean, we get fires through the winter as well, where there isn't snow on the ground. You've got very, very dry, fine fuel. It's not perfect conditions for fire, but the fuel is still pretty likely to catch on fire with any kind of ignition source. But we are going to see that as we get into the springtime. The snow's gone, the little amount of snow we've had. Although I'm sure we'll get some more early in the year. It will leave us vulnerable to grass fires, to wildland fires within the city, for sure. We had some pretty big ones this year. And actually, the out of town does impact us when you think about it, because we deployed 3 times this year. We've never deployed. I don't think we've ever deployed more than once in a year previously. I could be wrong there, but I think 3 times. With Yellowhead County, Grand Prairie, Yellowknife, our longest deployment to Yellowknife that I can think of in terms of distance, where we needed an airlift to get people there and back. that does have an impact. Obviously, we have to send the resources out of town when we have the resources. I mean, the first thing when I get a request is we look at what do we have in the way of equipment, what do we have in the way of personnel that we could spare, because clearly the bylaw in the City of Calgary makes it very clear to me that my primary responsibility is to provide services within the city. And we also get the question sometimes about how come it took so long to send someone there, Chief? And one thing you have to realize is this isn't something where you respond just because you feel you should and you send resources to a place. There's a very clear system in place through the province where the province will determine with the agency where, or the community where the fire is taking place, if other resources are needed, and then they will funnel that out to other agencies that they think can meet the need. So we always wait for the call from the province, much though that probably seems like a long time to some people. And then we will do what I said. We'll see what we've got we can send and how many people we can send. And we will always try to do our best we can. I don't think we've ever refused a call for service. But that's another thing. I think in 2024, we're going to see more of that, more of the same, because the same problems will exist in terms of these things often happen near small communities with very little resource. And we're one of the biggest resources in the province. So naturally, at some stage, we're likely to get the call again. So,
as a sort of a final topic for you, Chief, here, obviously stepping out of the fire hall into council chambers,
yeah.
2 years out of a 3-year budgetary plan here.
Yeah.
I mean, you've outlined some tremendous challenges the fire department is facing and some opportunities to tackle some of those. What is the ask to council in 2024? How do you approach them to maybe solve some of these issues?
Well, in fairness, I would give great credit to this council. I've never seen a council like this in my time, 30 years with Calgary Fire, in terms of their interest in the fire service and their willingness to support the fire service financially. That is a very difficult time. It's not an easy time. Public dollars are tight. So I would say Mayor Gondek and council have been very supportive, very significant investment last year through the 4-year cycle, another smaller investment for next year that they've just agreed upon. And we'll have to keep doing that. We've got to keep moving the needle. We presented council with a plan a couple of years ago about what would it take to be sustainable. And I think with the investment that's been made during this cycle, and probably another smaller investment in the next cycle, so 2027 to 2030, I think we'd see ourselves be pretty sustainable for a period of time. But of course, everything keeps moving, right? I mean, the city keeps growing, which means we need more resources just to cover it physically. And then if the call volume keeps growing, we'll have to reevaluate those needs. And we're certainly trying to provide the best value we can to the taxpayer in Calgary. I think we're not looking for a Cadillac level of service. We're just looking at a level of service that's sustainable, but it's also responsible for Calgarians, and it's great value for money, which is what I believe we are.
Chief, is there any final messages to Calgarians over the holiday seasons?
I think have fun. I would say most importantly though, make sure you have working smoke alarms, working carbon monoxide alarms. Take care with those decorations and those kind of things that are just different in your home. And of course, take care while you're cooking over Christmas. That's still the most common cause of fire in homes. And often people cook a lot more over Christmas. But have fun, but be safe as well.
Awesome. Thank you, Chief.
You're very welcome.